Well, good morning again, and welcome back to those of you who were here yesterday, and also welcome to any newcomers. For those of you who were here yesterday, I'm going to run through a lot of the same introductory information, so you can just grab a cup of tea or coffee and relax. Again, my name is Michele Caggana, and I, along with Dr. Joanne Bedurtha, are the co-project directors for NYMAC, which stands for the New York Mid-Atlantic Caribbean Regional Genetics Network, and we're one of 7 across the country. Our region includes DC, Delaware, Maryland, New Jersey, New York, Pennsylvania, Puerto Rico, Virginia, the U.S. Virgin Islands, and West Virginia. Our meeting this year is entitled Expanding Access to Genetic Services by Engaging Communities. Once again, I'd like to start off today just by focusing for a moment on this picture and its simplicity. I want everybody to take a few deep breaths because, as Erica just mentioned, we have a full schedule today. And just take a moment to relax before we start. All right. So at first, again, I'd like to introduce our planning committee. The NYMAC team is shown, all of the members here are shown on the right side. The planning committee consisted of Elena, who's a genetic counseling student from Columbia University, Shayla Clark, who you saw a lot and heard a lot from yesterday. She's a certified genetic counselor from the University of Texas Southwestern Medical Center in Dallas. And she's been involved in NYMAC for a couple of years and works with us in Puerto Rico and the Virgin Islands. Dr. Raylan Forsyth is a medical and biochemical genetics fellow from the Children's Hospital in Pittsburgh. You also heard yesterday from Maria Isabel Frankenberg. She's a consultant for NYMAC. Dr. Linda Freiling is a neonatologist at West Virginia University and is a member of our West Virginia team, and heard about the teams yesterday. Enrique Lopez, who also is very active in NYMAC and you met yesterday, is also a certified genetic counselor from St. Joseph University. And like Shayla, he became involved with NYMAC in 2021 and is well known to our team in Puerto Rico. Dr. Lisa Muñez is from the Albert Einstein College of Medicine and the Children's Hospital at Montefiore. Lisa Richard is a parent who's from the Center for Family Involvement at VCU. Rosiani Sanchez is the program director at Family Voices National and is our lead, as you heard yesterday, is our team lead in Puerto Rico. And Dr. Jerry Vackley is a medical biochemical geneticist from the University of Pittsburgh. And again, this group spent many, many months. In fact, as soon as this meeting's over, we start thinking about next year. So this group's been involved for a while in getting us to today. So I just wanted to kind of reflect back on day one. I wanted to give a big thank you to our interpreters yesterday, Maria Baker and Eric Ferrero. And then today we have 4 interpreters because of the concurrent sessions. So we have Coral Hutino, Andres Gutierrez, Maria's back for day 2, and Eduardo Garcia. This group is very adept in managing all kinds of speakers, those that are fast like myself, those who speak more slowly, and also managing technical discussions as well. I wanted to thank Alyssa for discussing the NYMAC updates. She gave a lot of areas for collaboration and reviewed resources and the work of NYMAC. Radhika, Shayla, and Enrique gave us updates on the ongoing work for our 10 different teams. And if any of these projects sound interesting and you want to get involved, we're going to drop a link in the chat for a Google form to fill out. You can complete that. It's very simple, or you can reach out to any of us, and believe me, Radhika will get in touch with you. Rosiani for her discussion on cultural responsiveness, and I think I could speak for all of us to say that this session was incredibly enlightening. And Maria Isabel for her discussions on cultural humility and our team stories and our collaborator stories. And lastly, our sponsors who manned the exhibit hall, and our first industry technical talk was held yesterday. And of course, all of our attendees, because your participation in the polls and the breakouts and the discussion groups really makes the event engaging and enjoyable for everyone. Here's our learning objectives, and I'll just give you a moment to read that. These are from the ACMG overall for the entire conference. Okay. And just a quick overview for day 2. you're going to have a chance to join one of two sessions. One will be on genetics and primary care and precision medicine. And then the other will be on updates and telegenetics. Then there will be a break. There'll be two more concurrent sessions, one on strategies for self-advocacy in emergency situations, and another one on structural racism and genetics and how to plan for the future. After that, you can grab lunch, and we have four industry sessions, and you can choose from one. They're concurrent, they're two concurrent sessions, so you could choose one from each. In the afternoon, we're going to have two more concurrent sessions on evaluation, quality improvement in genetics, or solving difficult cases from the Undiagnosed Disease Network and Rare Genomes Project. And then after visiting the exhibit hall, Alyssa will lead sort of the closing session on planning for meaningful change, and Dr. Berdertha will wrap up, and we'll be online in different breakout rooms for folks who want to continue the conversation. So the next series of slides are required for everyone to be able to get continuing medical education or credit for participating in this conference. It's 8.75 category 1 credits, and that's over both days. You will have 30 days to claim your credit. After, we're going to send out an evaluation after the meeting is complete, and you will get that emailed out to you. The next slide just explains all of the procedures for ensuring that all talks are free from bias. And then the next 3 slides are explaining how these procedures were followed for each of our speakers. And so these 3 slides have all of the individuals who are speaking and whose talks are available for CME. Okay. And this next slide has a lot of language on it, but basically explains how those procedures were followed for each of the speakers. And then the last slide in this set, again, reiterates how to get credit for attending. And once again, this information will be made available to you after the conference. This slide pertains specifically to genetic counselors and how to get continuing education units for them from the NSGC. Again, the same 8.75 category 1 contact hours. You have to attend both days of the meeting. You also have to be logged into the live webinar in order to get credit. It's the same link as yesterday. This is because we have to show who attended to NSGC. And you will have to complete an online report form and an evaluation that, again, will be emailed to you all after the meeting. You also need your user ID in order to be able to complete the form. And we're happy we're able to subsidize the fee. So the cost is just $10. And if you have any questions, you can feel free to email us. I also wanted to thank our exhibitors and collaborators. Those who provided sponsorship for the conference are in the teal color. Yesterday, we had a talk from Inozyme, and we are going to have, as I said, 4 other talks today and their concurrent sessions. And also want to thank the National Coordinating Center, and these exhibitors were also available during the exhibit hall, and you can visit them during those hours for the conference. The other thing I would like to mention is the advisory team, the advisory committee, and again, the NYMAC team is reiterated here. We'd like to thank Lorraine Swanson. She's our new program officer from Health Resources and Services Administration, or HRSA. And this group, HRSA, funds all of the regional genetic networks across the country. And Megan Lyon, who also helped us with leading the NCC. She leads the NCC and helped us in getting all of the continuing education credit established for this meeting. You will notice that we all have our logo and our teal backgrounds. So any issues you have or questions, you can reach out to us privately in the chat, and we'd be happy to help you out. Just a couple housekeeping things. Again, we have our family toolkit. It's available on our website. and we can put a link for that in the chat as well. Just a reminder that all of the open sessions are being recorded, but the breakout rooms and those discussions are not recorded. And most of the speakers have agreed to have the recordings and the slides available to participants after the meeting. And we also have them available in Spanish, and the site to visit is shown here. And just a reminder that we are trying to be responsive to all attendees. Our staff are online to answer any questions, and we're monitoring the chat, and we will address any concerns that people have. So just a few closing thoughts. Again, thanks to our planners, to Pat, Alyssa, and the Marks team, and our interpreters. It takes a village to plan a virtual meeting. Don't forget to fill out the brief evaluation we talked about yesterday. That's just for us. It's a just to get some information and feedback from you about the conference. We use that information to improve for the following year. This is a brief survey. It's not the CME survey. Again, that will be sent out after the meeting. Don't forget to visit our exhibitor booths and the NYMAC room. And please continue to participate. Again, it's fun. Stay tuned. There's prizes. We had 2 winners yesterday at the end of the day. And also check out our website now and regularly throughout the year to learn about our projects. We're constantly posting new resources, events, and opportunities. And as Alyssa mentioned yesterday, we're on Facebook, LinkedIn, and YouTube. So thanks in advance for joining our social network. And with that, I think we're going to put up a Mentimeter. And the question is going to be, if you were here yesterday, give us a few words on what you enjoyed the most. And if you're new today, give us a few words on what you're most excited about today. So we will post that. I have to unshare my screen. Click on the link in the chat there and it'll take you to the page. I see Fred's music, interactivity, Spanish inclusivity, seamless tech experience. That's awesome. Cultural awareness, the music again. Having the session in Spanish and translations in English, flipping over the interpretations. Enthusiasm, we like that too. Cultural responsiveness. Rosani's presentation was an important experience, I agree. Respectful discussion of sensitive topics, thank you. Inclusión Español from Vilma in the chat. All right, great. Thanks so much for your participation in that. I am now going to turn it over to Alyssa, and she's going to introduce how our concurrent sessions will run.